If you've ever had trouble with your hearing, chances are you've seen an audiologist, or maybe avoided one. Audiology blends the knowledge and application of science, technology, and healthcare. According to the U.S. Bureau of Labor Statistics, this occupation is considered a bright outlook occupation, a designation it receives because of its excellent job outlook. Employment is expected to grow 29% by the year 2024, which is much faster than the average for other occupations. With such a promising outlook, more and more young adults are choosing audiology as their career path. We decided to talk to Paige Holt, a doctor of audiology at Lake Ear Nose, Throat, and Facial Plastic Surgery, to find out what drew her to this sophisticated occupation.
My sister and I are both doctors of audiology, and we love what we do. And we feel like we do that because our grandmother was profoundly hearing impaired and has been that way for all of the life that we remember her. And so we both have a passion for people who are hearing impaired and helping them hear better. And she is a great inspiration to what we do. My sister practices a different aspect of audiology than I practice. I fit hearing aids. My sister goes into surgery and monitors the hearing nerve during surgery, but we both love what we do. Success with my patients would be having a smile on a face, having someone say, "I wish I would have done this years ago. I can't believe how well I'm hearing," or just simply putting a hearing aid in and seeing for the first time their significant other, their child, their spouse say, "You're hearing me, and you were not hearing me an hour ago." We see many patients upon referral of the physician, and we see many patients who just come in on their own. Probably a large percentage of our client base is from a referral of other patients that are happy with our services. So we get phone calls and people can come in for just a hearing evaluation. Once they come in for their hearing evaluation, if we determine that there is a medical condition involved, then we will recommend that they see the physician for further evaluation before we proceed with any recommendations on hearing aids. However, if we do not detect that there's any problems medically, then we will go ahead and proceed with hearing aids. We have physicians, we have physician's assistants, audiologists, and hearing aid specialists all on staff, and we all work together. And there are times when I may be puzzled on what do you think would be the most appropriate hearing aid for this individual, and so I will walk down the hallway and I will ask, what products have you tried recently? Have you tried a product on a hearing loss that looks like this, and how did it work? And so we work together and we get feedback on one another. It's very rewarding to have a phone call or have someone come in and say, "I'm hearing things I never heard before." It's very rewarding to get a phone call from a child to say, "I thought that my mother was having problems with dementia, and now I realize that it was just problems with the hearing. And I see a new person. I feel like my mom is 10 years younger than she was."
In case you're wondering, all 50 states have licensing requirements for audiologists, varying by state. In most cases, a licensed audiologist needs a doctorate in audiology granted by an accredited program. The median annual salary for the position in 2015 topped $74,000. For more about the hearing aid and audiology services available at Lake Ear Nose, Throat, and Facial Plastic Surgery, and a link to their new website, please click the Audiology Outlook story link on our homepage at yourhometownhealth.com.